Hello everyone, I'm Paige Dutton-Mofford, and today I'm going to be discussing with you yeast infections in women. So to start off, what is a yeast infection? This could be described as an annoying, pesky, and reoccurrent itchy mishap in the vaginal area. So around 75% of women, at least once in their life, will get a yeast infection, and it's most common in ages 16 to 35, though you can get multiple yeast infections, unfortunately, in your lifetime. So what causes a yeast infection? That would be the culprit, candidiasis. Candidiasis is a natural occurring fungi that is in all of our bodies, and it is found in many different types of forms. So it can be Candidiasis albicans, glabrata, tropicalis, and cruzi. These are just a couple. They're all found naturally in your body. It is the overgrowth of the the fungi that causes a yeast infection. So the most common culprit for vaginal yeast infections is Candidiasis albicans. So that's the cause of 80% of vaginal yeast infections. So what causes this overgrowth of Candidiasis albicans? There could be multiple different things going on. It could be immunosuppression, anybody with an immunocompromised, immune system, antibiotics, clearing out, all of the good and bad bacteria and fungi can cause an overgrowth of the bad, leading to a yeast infection. Could be an underlying issue or disorder like diabetes that needs to be taken care of. It can be things like pregnancy, because pregnancy can cause immunosuppression to avoid getting rid of the fetus. So that can lead to, unfortunately, an increased likelihood of a yeast infection in pregnant women. And things like douching in tight clothing, just improper hygiene, can also lead to a yeast infection. So what are some symptoms that you can see whether or not you would have a yeast infection? For women, the most common are itching, a visible white discharge around that vaginal opening on the outside of the labia, irritation and rash, and pain with intercourse. So if you've noticed that you have kind of a recurring yeast infection, doctors do say to go in and get checked because it is possible that it's undiagnosed HIV, which can be passed back and forth between a woman or male and a partner. So how do we diagnose? Doctors diagnose under a microscope to view that fungi, and then they will likely prescribe either an over-the-counter or an antibiotic. But if your symptoms are still not improving, doctors usually order a culture. It's a little bit more in-depth and looks for that specific type of fungi to really target to make sure you're dealing with Candidiasis albicans, or if it's a different kind that needs to be handled differently. Be warned that an untreated yeast infection in women can unfortunately lead to infertility and or cervical cancer. Of course, that is the kind of extreme, but it is possible. And for any women to kind of self-diagnose a yeast infection and use over-the-counter, you're always at the risk of misusing it and causing an antibiotic resistance or the formation of what's called biofilm. So this is just kind of a rundown of yeast infections in women and the causes and symptoms and how we diagnose. Thank you for your time.